I guess. All right. And we are live, I believe. Hi, everyone.
Hey.
I think we are. I hope we are. Here it goes. Hi, everyone. I am Dr. Funke Afolabi-Brown. Really excited to be here today with my friend,
Mhm,
Dr. Elisha Peterson. And
mhm,
so we're going to be having an incredible conversation. This is actually the very first time we are broadcasting on LinkedIn as live. I'm hoping we are. I want to believe we are. And so if you are on here, if you could just like let us know that you can hear us, that would be incredible. Um, so this is the very first time, and this is the face and the voice of Dr. Funke Afolabi-Brown. I am the founder of Restful Sleep MD, and I'm really excited to have a conversation today with my friend, Dr. Peterson, and we're going to be talking about the relationship between sleep and pain. And I think this is going to be a really exciting conversation. And so I think what we'll start off with is to introduce Dr. Peterson. And Dr. Peterson is a TEDx speaker. She's an anesthesiologist. She's an extraordinary person, and she is a real expert when it
mhm.
comes to pain management. So thank you so much for joining us today, Dr. Peterson. Can you just tell us a little bit about yourself?
It is such a pleasure to be on the show right now and to be speaking with your listeners. And I hope that this helps clarify any misunderstandings and some confusion that we have with this relationship between pain and sleep. But as far as more about me, the TEDx, which is very much relevant to what we're talking about today, is called How Chronic Pain is Like Falling in Love. And so feel free to YouTube that, and I'll also provide a link for Dr. Afolabi-Brown to include. Uh, but yes, so how should we get started on this huge topic?
First, we're not just going to gloss over the fact that you
Yeah.
literally were on TEDx. So maybe tell us a little bit about first a real quick one or two liner about
Mhm,
what that experience was like. That's one, and
mhm,
then also like what was that talk about the falling in
mhm.
love? Like I just need you to just demystify that. Like I'm just like whoa, okay, so congratulations,
Yeah.
big deal. We're not just going to let that. We're just going to gloss through that. So tell us a little bit about what that experience was like, and
Mhm.
then also really maybe some high points around your talk that's going to motivate our listeners to go real quick to YouTube and grab that link and watch the TEDx the entire episode.
Yes. So, one piece that I noticed in clinic all the time is whenever we talk about pain treatment, patients always walked away with, well, why hasn't anybody offered this before?
Mm,
No one's ever talked about doing, the body, mind, and social kind of treatment that we talked about, the holistic
mm,
treatment, and that was comprehensive and addressed not only where they said they hurt, but also the root of the issue.
mm,
And so I was like, wow, the model that we use to treat pain is called the biopsychosocial model. And
mm,
just simply broken down, bio is body, psycho is the mind, and then social, which is really working towards repairing those relationships that have been neglected due to chronic pain. And
mm,
so I said, you know what? This model that we use to treat chronic pain, really everyone could benefit from this. We all need to spend some time every day to move our bodies and to take care of ourselves physically. We all need to have some skills on how to deal with life stressors. So that's the mental part of this, to fortify ourselves physically and mentally. And finally, we all could benefit from re-engaging with those hobbies that we abandoned, reconnecting with family and friends that previously restored us and we enjoyed their company. And so it was out of wanting to share this model of treatment that we use for patients with pain for everyone to benefit from this. And that was the spirit in which the TED Talk was given, and that was
Mm,
why it was given. And it was an incredible experience. Um, for those of you who are in academics, or really everyone is giving like PowerPoint presentations nowadays, you think that you know how to speak because it's like, yeah, how many of those presentations have you given?
mm,
But the TEDx experience, because you are including a personal piece relevant to yourself, you're including that within the education, it makes it more personable. So it's
mm,
not in any ways like a routine presentation you'd had to
mm,
give,
mm,
whether that's in front of a conference room or in an auditorium. It's
mm.
very different. And I strongly encourage everyone has a TED Talk in them.
Oh.
And I think it's worth fleshing that out and having that
Mm.
experience.
And it sounds like it was a transformative experience for you, and you've already given us some teasers. So you guys, we're gonna actually put the link to. So if you send me the link to
Yeah,
the YouTube video, I'll be able to put that in. It just went live, so that's really
yeah.
exciting. So now I think that's a perfect segue to what we're talking about today. What is this interaction between sleep, pain, and sleep? Because I get referrals as a sleep physician for patients who have chronic pain, right? Pediatrics, young adults, parents. And because of that, they're having issues with sleep. And there are some times when, even after the pain has been sort of managed in that sense, they still continue to have that, you know, those sleep issues. So maybe tell us a little bit about this real complex interaction that we have. That's almost like a, almost like a vicious cycle.
Yes, absolutely. So, in order for me to adequately address that question, we have to discuss what pain is.
Mm,
Because so often we assume we know what it is. Everybody has experienced pain before. But just because you've experienced it doesn't mean you know what it is. Okay.
mm,
Um, so everyone is familiar with the, oh, I stubbed my toe or I broke my bone
mm,
and I have pain. So they point to the injured area of their body and they say,
mm,
well, this hurts. This is where my pain lives. It lives in my arm or it lives in the stubbed toe. But what we know actually is that pain doesn't reside in that injured part of the body. Pain is controlled by the brain. And I can say
mm,
that because when we look at soldiers that have had limbs blown off, they're still running on the battlefield, dragging their fellow combatants off the field, and they lost their
mm,
other arm, didn't even know it. And they're helping their combatant off the field. So we know that pain is not tied to tissue damage. Because
mm,
if it was, those soldiers would have known immediately that their limb was blown off. They'd be in agony, writhing on the ground. They couldn't help anybody,
mm,
not even themselves. So then that makes us ask the question, well, if it's not tied to tissue damage, where does it live? And it's in the brain.
mm,
So think about this. A sensation comes in from the outside. It could be, you touched a hot stove. When that sensation, maybe not the hot stove because you're going to reflexively jerk your hand,
mm,
but let's say you're in the woods and you trip, right? And you fall to the ground and you hit your ankle. That sensation coming from the ankle is traveling up the leg, up the spinal cord, into the brain. Now, as it's making its trip to the brain, it's going through that sensation, it's going through a series of filters. One filter is prior experience. Have I been in this forest before? Am I scared? Um, do I enjoy what I'm doing? If fear is a part of your sense of experience falling, then that sensation that went up your brain, went up your spinal cord to your brain is going to be increased.
Mm.
So, however, if it's something where you're like, oh, this is the woods in my backyard, I'm very familiar, like this is nothing, that sensation is turned down.
Mm.
Well, that same person who tripped in the woods, if it's their backyard, they could just get up, dust themselves off, no big deal, keep running.
Yeah.
But if it's somewhere where they're scared, that sensation is now amplified. They could be crawling on the ground saying, oh my gosh, I can't get up. So,
Mm.
prior experience is one filter it goes through. Another is, what is our mood? If we're chronically anxious or depressed, that's going to cause a sensation to amplify within the brain and worsen the experience, causing it to be painful.
Mm.
Another one that we know is temperament. So, we take care of kids, and there are some kids where, as long as they got that video game in front of them, the world could be crumbling around them and they wouldn't care. Someone could take a bat to their foot, they're like, they just keep going, right? And
Mm.
then there's that other kid where everything could be perfect, but if there's a carrot on his plate, it's everything is shot, right?
Mm.
He's on the ground. This is horrible. The world is ending. So temperament is also a big deal. So,
Mm.
so with that being said, with pain going through these multiple different filters, and mind you, these filters are personalized to you.
Mm.
So me and you aren't gonna experience the same thing the same way.
Yeah.
So, with that being said, with pain being mitigated by the brain and going through these filters that are personalized to you, um, now let's enter in sleep, okay? Because when we talk about pain, and we talk about specifically chronic pain is when those nerves that provide that sensation from the outside, they become scrambled. And so now we have a sensation of unpleasantness that just doesn't cut off
Mm.
because we have now a neuronal imbalance. When you think about what sleep does, sleep, I always tell patients that throughout the day, our brain is having a party, and sleep is the time to clean up after
Mhm.
the party. If we don't have good sleep, then all of those nasty, it just sits there and it accumulates day by day. And so when we talk about getting better from pain treatment and repairing those scrambled nerve signaling,
Mhm.
we need good sleep in
Mm.
order to help restore proper nerve firing so
Mm.
that we're not constantly faced with, again, like chronic pain.
Mm.
And so that is how sleep and chronic pain are related. So many times in my clinic, I've seen patients with already having sleep disturbances. Like
Mhm.
they have not been getting any sleep. And
Mm.
in my mind, and the literature supports this, well, that sets them up to having chronic pain.
Mm.
Because as I said, they're all of that junky metabolites sitting throughout the day. They're not getting any sleep. They're not getting restored. Well, those nerves now have a higher likelihood of hot wiring, if you will, or being those signals becoming scrambled. And
Mm.
because they have that propensity, well, guess what? They have a sensitivity now to developing chronic pain.
Yeah.
And when that sensitivity and when they have that likelihood of developing chronic pain, well, that's where the vicious cycle comes in
Mm.
because poor sleep makes it likely for you to develop chronic pain, and then pain of, would result in having, poor sleep.
Yeah, that's a very great. Thank you so much for shedding light on that. So it's literally bidirectional. Poor sleep, it sounds like.
Yeah.
Um, I would say it kind of lowers that threshold where you feel more susceptible to pain.
Yeah.
And then your sleep quality, right, is disrupted when you don't sleep. And so it kind of feeds itself
Yeah.
constantly. So now how do we break that cycle? There's a lot of the medications, there's strategies. And, at the end of the day, a lot of times, and like what you said, the biopsychosocial model, I think that is a powerful way to look at this. Like, it's not just one thing, because at the end of the day, sometimes even fixing the actual pain, like treating the pain, sometimes doesn't automatically mean that you're going to resolve your sleep issues. And just for those that are watching, what are the kind of sleep issues that you can encounter when you have chronic pain? Usually it's insomnia. Insomnia is one of them, right? Difficulty sleeping, falling asleep, staying asleep. You may wake up with, fragmented sleep. You may wake up feeling exhausted. You might have, like Dr. Peterson said, concurrent sleep disorders like depression or anxiety, which can also drive sleep issues. In some situations, depending on how long standing the pain is, you might have things like obstructive sleep apnea, maybe because from weight gain or from the medications that you've been using, because some of those medications kind of relax your airway muscles. So that's another way by which it feeds into it. And then in some certain conditions, and correct me if I'm wrong, Dr. Peterson, things like fibromyalgia, chronic limb pain, um, you know, GI distress, chronic gastrointestinal pain, migraines, all those things can affect your body significantly and impact your sleep quality. With fibromyalgia, there's been some studies that have shown that people may be at risk of a condition called restless leg syndrome or periodic limb movement disorder. So that's another sleep problem that can, further make things even worse. And so there's quite a number of things. We're using the general term pain, knowing that, like you said, so many of this, there's so many layers to it. But now, that person that's looking to really break that pain cycle, maybe using not necessarily it's really the medication route. That person is looking to go through this using the biopsychosocial lens, and also maybe a more holistic approach. So what are just some strategies that you would recommend that can help with that?
Absolutely. So let's look at what many chronic pain patients do when it comes to sleep. Many of them spend a lot of time in bed
Hmm.
because it hurts to get up, it hurts to move. Often families come into, when it comes to pain, many of them think of this as what we would call acute pain, like pain caused by tissue damage. So when you treat all pain the same, in that, like, for example, for acute pain, somebody who has a broken bone, for example, you would tell them to rest and
Hmm.
take a medication, and then eventually pain will go away. Um, Problem is, though, is that when you use that pain strategy for chronic pain, pain only gets worse, because there's not any tissue damage that's driving the pain. It's due to, like we said, the nerves abnormally signaling. So uh, we have to first tell families that we can't treat this like it's a broken bone kind of pain. So we cannot just lay in bed all day and hope that medications will take it away, because it'll only make that nerve firing even more abnormal. So that's number one, which means that we have to tell patients to get out of bed, because if they do everything in bed, watch TV, homework, what have you, then their brain does not associate that bed with sleep. So that's a big piece. So, one, getting out of bed and only using bed for sleep.
Hmm.
Secondly, uh, we always encourage our patients to maintain a schedule. Like, we want our kids to stay in school despite pain, because, as I mentioned, pain is mitigated by the brain. And school has a ton of rich distractions to help. And it keeps them to a schedule, which is huge, because that's another reason why we're not getting good sleep, is because one day we're up till 2 in the morning, and then the next day, you fell asleep at 3 in the afternoon. I mean, there's no regularity. And so it's really key to have a schedule, get out of bed regularly, go to bed when you're sleepy. Uh, Another aspect of this, when we talk about improving, is our kids, they need to get tired. Like, in order to be sleepy, you have to do something to make yourself tired. And so that means, again, moving the body in a way that isn't, you know, over exertional, but it is something. So that's why a lot of our kids, we refer them to physical therapy so that they can have personalized plans. So we see where they are in their function now, and then make goals that we have to work towards. So many of the kids that I've seen have been athletes, and so their goal is to get back into soccer, or they love that. And so what can they do now that can be modified to get them closer to where they need to be? So another piece I would say is gotta get up and get active and get ourselves tired, and that's going to all help facilitate sleep. Now, you mentioned medications earlier. And pain medications, what everyone thinks of when we talk about pain medications is opioids. That's the big one. Morphine, oxycodone, Dilaudid, the whole bit. And for chronic pain, we don't encourage the use of opioids chronically for those who have non-cancer pain, because we know over time opioids can make you even more sensitive to pain. But as we talk about opioids in relation to sleep, because there are, for those who have pain relating to like a trauma, like you just had surgery, for example, if you have severe pain, yes, use the opioid. That's what it's there for. And use in the short term won't cause any long-term negative consequence. However, even in the short term, we know that opioids can disrupt that sleep architecture. It can mess with your slow wave sleep. So yes, many patients will say that, after they take like oxycodone, they feel tired, but that's not good quality sleep, right? Yeah. So that's the one caveat that we have to be aware of when it comes to using that class of medication. And then for those who have nerve pain, the medications like gabapentin and Lyrica, these are medicines that can cause sleepiness. So we often recommend taking them at night to help with those who have both pain and sleep problems. And then there are antidepressants that we know, again, chronic pain is comorbid with anxiety and depression. A lot of patients have both of these or all of them. And so we know that antidepressants can have an effect on sleep as well.
Oh, really good. Really sorry. Did you have one more?
Well, when you talked about fibromyalgia, when it comes to chronic pain, I will put this out there that medications isn't our first go-to for pain complaints. We really want to look at using restorative therapies such as cognitive behavioral therapy, physical therapy to address chronic pain, because this is engaging the body and mind that will help restore that abnormal nerve firing that we talked about with chronic pain. But there are some patients whose pain is so severe, they're not able to engage in those therapies in a meaningful way. And in those patients, we do look at starting a medicine just to help bring down their pain intensity so that they can participate in these therapies. And so for patients with fibromyalgia, for example, a medication that has been, that can be of some benefit is the selective, the serotonin norepinephrine reuptake inhibitors, the SNRIs. And one example of that would be like duloxetine. The thing with that is we know that serotonin, when it comes to sleep, it can, depending on where it's acting, it can help sleep, it can hurt sleep. Serotonin also, when it comes to pain, depending on where it's acting, it can be analgesic, it can help with pain, or it can make pain worse because it's involved with inflammation. So it's not straightforward. There's a lot of complexity and interaction with it. But we do know that like medications like, duloxetine, um, I've had patients who've taken that at night and it has messed with their sleep. So the timing of it and taking it during the day uh, can help. But
Mhm.
yes, we have to be aware of how these medications are taken so that we're not helping one area but then hurting another. Because again, we can't make good progress with sleep with our pain treatment if sleep is chronically impaired.
Yeah.
Yeah.
Oh, these are so, so good. So many nuggets you've shared with us. So we've kind of talked through more non sort of medication strategies, more holistic strategies. We've covered also some practical things that you can use to still optimize your sleep. Like you said, if you're there's the likelihood to want to just nurse your pain and just stay in bed and not move around, but when you're doing that, you're dropping your what we call your sleep drive. And so without being physically active, it's going to make it hard for you to fall asleep. And remember, again, that's going to make your pain even worse during the day, or make it hard. You have that sensation of pain more. And so engaging in some form of physical activity is really important, having some kind of schedule. And so the tips you shared is very helpful for our kids, but I think as parents as well, we can all take away from this, right? Like you just want to shut everything down. You want to turn off all the appointments. You want to cancel all the appointments and just stay and nurse your pain. But really trying to go through the normal day is actually very important because it takes your mind off the pain that you're having and focuses it on other things. And this is just so similar to sleep. I just have to put that in this pain as a symptom and either poor sleep or insomnia as well, right? Because when you have sleep difficulties, you may start to have this perseveration around, oh, I'm going to feel exhausted because I didn't sleep well. So I'm going to stay in bed and try to rest. You may say, I don't want to be physically active because I'm tired. So I'm not going to just do much. I'm going to cancel all my appointments. And so I like how it's this pretty similar strategies of regularities, consistency, having a routine, going about your day like you typically would as much as possible, engaging in physical activity, all those things, making sure, like you said, what you talked about was stimulus control, which is not just laying in bed all day. Because when you lay in bed all day, your brain is going to make associations between uh, being awake and staying in bed. And so when it's time to sleep, your brain doesn't even know it's time to sleep. And so avoiding using the bed only for sleep is important. Even if you're on pain and want to sit on a recliner or a chair, that's actually more beneficial. So thank you for highlighting that. And then we went through some other medications, which I think is so powerful. But like you said, it's not a one size fits all. And it's similar even for sleeping medications. We don't necessarily recommend that for chronic use, but if you have people that are exhausted, they're on the verge of road traffic accident or whatever it is, sometimes we'll give some medications just to take the edge off while they work on those cognitive behavioral strategies. So the same way you have CBT, cognitive behavioral therapy for pain, we also have cognitive behavioral therapy for insomnia. And many times we end up using those CBTI strategies for people with chronic pain and insomnia. So, and what does that look like? It looks like changing those beliefs around your symptoms. It looks like changing some behaviors to optimize sleep. And then, of course, general education about healthy sleep practices. And so,
Oh, one
yes,
piece I want to add that I just absolutely love is, so when we talk about setting an environment for sleep,
yeah,
so often people are, they say turn down the noise, have a
yeah.
quiet room, no distractions. But for those patients with chronic pain,
Mm,
a quiet room is a bad thing.
mm,
No distractions is a bad thing, simply because now their brain is focused on the pain.
right.
And so that is when we ask them to employ those cognitive behavioral strategies,
Mm,
to instead now give their brain these tools to use to focus on so that their perception of pain isn't worsened. Um,
mm.
so thank you for, yes,
Oh,
bringing up
that is so
exactly what
good.
cognitive behavioral therapies are.
Yeah, thank you so much for bringing that up. That's really true. That's really important. Now they're focused on their pain, so really finding those strategies, I think, is so meaningful, so helpful. Well, this has been very rich. It's it's been filled with so many nuggets, and I think even practical tips that people can start with. I think some things I'm going to say is, if you're someone who's struggling with chronic pain, as you see, it's not a straight, there's no straight path to this. So definitely speak with a professional, so that they could come up with a pain plan, I would say, for you, that's going to help boost your sleep quality as well. And so I would love for you to tell us, Dr. Peterson, where can we find you? If folks are planning to, they want to work with you. And I know you just gave the TEDx talk. I know that's not the last talk you're going to give. You probably have some other opportunities coming up. So how can people work with you?
Yes, thanks for bringing this up. So, one piece that I always found when I was working in the clinic was I was filling out so many forms for parents on work, to be for them to be able to have the time to take their child to their appointments, to their therapies. Parents really worried and concerned about, am I going to be fired? Am I going to be let go because I need this time to take care of my kid? And so that led me to think, wow, there needs to be support in the workplace aspect, because chronic pain, when it's in a child, doesn't just affect the child, it affects the whole family.
Hmm.
And no parent should feel concerned or scared that they're going to lose their job because they need time to take care of their child. So that has led me to looking at corporate consulting, mainly training and teaching workplaces how to best support families who are dealing with chronic pain, as well as how workplaces can be more holistic, to support families, not only those who have chronic pain, but to prevent um, exacerbation of anyone who has any chronic condition.
Yeah.
So what I would recommend is for to reach out to me on my website, which is listed there, elishapetersonmd.com, in the contact us, and connect me with your workplace. I'm
Yeah.
very happy to lead trainings and coaching, so that we really can support families, in and out of the hospital.
Oh, thank you so much. That is so good. So elishapeterson.com, and I'll put that in the comments as well. I think this has been so powerful. And another thing I wanted to remind you guys of is the restful sleep place is open and we're seeing patients. So if you're at that point where pain has become really the bane of your sleep existence, in that sense, we can work collaboratively with your physician to also fix your sleep issues, because again, addressing the sleep issues will improve that pain. Of course, working on the pain will improve. So it's a vicious cycle. And so I invite you to schedule your appointment at therestfulsleepplace.com for that. And so that we can have this experience where we're living our best holistic lives, right? In my practice at the Restful Sleep Place, and I think just like you as well, Dr. Peterson, is we're looking at this from a different lens. It's not just about prescribing medicine, it's about what is driving these issues. And so I hope that you'll take advantage of that. And also, if you have any questions or anything, feel free to send me a message. I would say this has been an incredible episode. It's been such a joy talking with you. I've learned so much myself, and just thank you so much for joining us, Dr. Peterson.
Yeah, it is my absolute pleasure. And again, any questions anyone has, feel free to reach out. I'm happy to answer them.
All righty. All right, everyone. Take care until next time. Bye.
Bye.